Okay, welcome.
Hi.
Hello. All right, so this is the kind of unnamed Viva Eve podcast. We have Alexa Grigley. She's a nurse practitioner. She's our Fibroid Navigator.
Yes.
Can you please explain to the people what that is?
Yes. So I am essentially putting all the pieces together. Patients come in, they know they have fibroids, but they want to get another opinion.
Okay.
So I am coming in and looking at all of their prerequisites essentially to go down that fibroid journey and get them to the spot that is going to best suit their
needs.
Yeah.
Right?
Mhm.
So we know we have a real special journey for patients carved out here at Viva Eve. Can you tell us what are the real, like the big milestones of women who come here? They're seeking help for fibroid pain, discomfort, all the things that come along with having fibroids. What are the milestones that we've set for our patients and how you navigate them through that process?
Yeah, so we always want to make sure someone has an up-to-date pap smear.
Okay.
And then we also, if you are having heavy menstrual bleeding, we always need to rule out the worst case scenario, which would be endometrial cancer. So we do have the biopsies that we do in-house. We do it under a light sedation, which some people prefer because a biopsy is uncomfortable. And so allowing to have a light sedation is comforting. And then we have to get MRIs to get a better picture. We do sonograms at almost every visit to keep tracking of the fibroids, how big they are, where they are. And then the MRI is something that we send you out for. And that's the only thing we send you out for. To really get a better image of those fibroids and see if you're a candidate for the UFE procedure.
Okay. So we have the UFE procedure. That's uterine fibroid embolization.
Mm-hmm.
What else? What are other women being told are options besides UFE?
Hysterectomy was like the gold standard back in the day of like that was
gold is in quotation marks.
Right. Yeah, as like that's the only thing we can offer you, but now medicine has advanced. So there's hysterectomy, there's myomectomy, and then there's also hysteroscopic myomectomy, which if someone's trying to get pregnant and they don't want to go through with certain procedures because of wait time of trying to conceive, then we can, if there are fibroids in the cavity, meaning inside the uterus, that are impacting implantation of said baby, then we can go in there and remove those to make it a better environment.
Okay. So in a UFE though, I know it's minimally invasive, non-surgical. What is happening during a UFE? Like if I'm on the table, what's the doctor doing with me?
Yeah, so it's performed by an interventional radiologist. This is their specialty. And what's happening is they are going through either the artery in your wrist or in your groin. And they are, the whole time there's getting cameras to watch where that catheter is going in your body. And they track it all the way down to the uterus. And that's where they would use a dye, similar to an MRI dye, to kind of light up that uterus to see where those fibroids and like what we call like a spider web or tree branches of vessels that would be feeding those fibroids. And then they are using medication in the veins to kind of shut down that blood flow.
Interesting. Okay. So when your patients are coming to you, you're walking them through these treatment options. Let's say they go through with the UFE. What do they come back saying when they come to a post-op? What should a patient expect? And what are patients coming to you and telling you as far as outcomes go?
Yeah, outcomes, they're thrilled. They always say, sometimes the initial post-op at 2 weeks, they are still a bit uncomfortable, just kind of like some cramping on and off as if you were to have like a period. But usually after that first 72-hour window of immediate post-UFE, people are already starting to see the downward trend as far as cramping and symptoms of just being like fatigued from having anesthesia. But afterwards, at that 6-week appointment and thereon, people are really pleased. They have a lot less cramping with cycles, a lot lighter flow with cycles. If they were having intercourse, you can have intercourse starting at 2 weeks post UFE, and they're no longer complaining of pain if that was one of their symptoms.
Oh, okay.
Yeah.
So this is great.
Yeah.
This is great. Now, if patients go for the myomectomy, hysterectomy, whatever that journey is for them, obviously hysterectomy is pretty major surgery. I imagine it's effective. I mean, have you had patients go the surgical route yet in your time here or previously?
Yeah, we've had definitely some cases, just because, for other reasons, people maybe they have more high risk cells, and so doing a procedure such as UFE wouldn't be a candidate for, because there's more risk for cancer for them. And so obviously you're taking the uterus out. So if you did have a problem with fibroids or adenomyosis, it's now gone. But it's recovery from surgery, which is intense. It's at least 6 to 8 weeks, and restrictions. Myomectomies also an option. But same thing is just, having to make that call of, are you prepared to have a major surgery, the risks that go along with having a major surgery. So just, we obviously do all options, but we want to line out risk and benefits of everything. And then ultimately this decision is up to the patient of what's going to be great for their life. Okay.
So you mentioned adenomyosis. This is something that we've been internally talking about on the marketing team, because we know that a lot of women actually deal with this, but a lot of doctors cannot
figure it out.
They can't figure it out. And they might not have like the right devices or machines or whatever it is, or the tests. How many women are coming to you with symptoms that kind of feel like fibroid symptoms, but they actually have adenomyosis? And how do you treat that?
Yeah, so it's super common. I think a lot of my patients, even just last week, were like just so happy after their first visit, because they were able to hear that, like, yeah, my symptoms I've been complaining about for years actually have a diagnosis or a reason. And, I'm not just crazy, and I don't have to just deal with this and, well, this is your life, so sorry you have a uterus kind of thing. And so a lot of people are just relieved to know that there's an answer and there's a reason for the way they're feeling, and there are ways to treat it. Whether you want to be very conservative and just try to manage the bleeding that you're experiencing with medications and, birth control or something like that, and you're not ready to go down that journey of an actual procedure, there's options for you as well.
Okay. And adenomyosis, for those that don't know, how do you define it technically, medically?
Technically, medically, it's when the endometrial lining in the uterus, those cells start to grow outside where they belong into the muscles of the uterus.
So women are coming to you. I had endometriosis. It took 15 years to get diagnosed for that. Is it a similar kind of time frame for fibroids and adenomyosis?
If you're not finding the right doctors, a lot of people, they've been like, my whole life. I had somebody who was I think 38 the other day, and was like, I have been dealing with this my entire life and having my cycle. I've had my cycle since I was 14 years old. So if you're just kind of being like, this is how like your periods are going to be, and not going down any further. Some people don't know to try to find other doctors, and they just can't get the right answer.
Well, when did you start at Viva Eve? You've been here how long?
Since April.
Okay. So we're heading into month 7. Been here for solid 6 months. What has been the most rewarding thing for you so far in being this fibroid navigator? Because your role, what you do, is not everywhere. We have this, I think it's pretty special what you do. So what has it been like for your last 6 months?
I would say it's rewarding. It's rewarding, even just like, not even just seeing somebody go through the whole journey and see how they are after we've treated them. I think just as that example I mentioned of somebody after their first visit having relief and like so thankful that like, oh my gosh, you've given me something that I'm like, this makes sense. I feel this way. And so I think just seeing the changes that I can make in people's lives and helping them through this process.
That's awesome. Thank you for coming in and chatting with us.
Yeah, my pleasure.
And you're getting married.
Yeah.
All right, well, have fun. Thank you for taking such great care of our patients.
Yeah.
All right, I'll see you soon.